Excellent. Feel free to ask any questions you might have. My name's Heather.
Thank you so much. I look forward to learning a lot from you. So you're taking care of the patient room 620, right?
Mm-hmm.
Do you have time to give me a report?
Sure. Patient 620, name is Ryder Kind. He's a 67-year-old male. He presented with a stage 2 diabetic ulcer on his right heel. He complains of increased blood glucose reading for the past 5 days. They were all up in the 300s. And he's been a type 1 diabetic for about 20 years already. He doesn't have any allergies. He's a full code. He is ANO times 4. His pain level was 6 out of 10. We did give him morphine, and now it is a 1 out of 10. He's Perla. He wears glasses. His gait's fine. He's a medium fall risk. He has clear lung sounds, even effortless. All pulses are +2. Cap refill is good. Normal rhythm is good. Bowel sounds are all active. He eats meals fine, adequate food intake, and his urine is coming out fine. It looks like he did already take his simvastatin, gabapentin, insulin, and pH. We're going to be administering the regular insulin, and he has an IV site in his right forearm with a saline lock. Last AccuCheck was 290, and vitals are pretty stable right now. It looks like temperature is 98.4, 76, 96%, 128/70 was his last blood pressure. So we're going to be administering the regular insulin.
Thank you so much for the report.
Sure.
Do you mind if I ask you a couple of questions regarding the medicine you're going to be giving him?
Sure.
And what you give it to him too?
Mm-hmm.
Okay. The first question I have is, why are we giving this medication to the patient?
Well, we want to control his hyperglycemia. The regular insulin lowers his blood glucose by stimulating the uptake in skeletal muscle and fat, and it inhibits the hepatic glucose production.
Okay. And when should you administer this medication?
You want to administer it.
I'm sorry, you said for the glucose.
Mhm.
But when should you question giving him the medicine?
You'd question it especially if the blood glucose hasn't been checked recently, or if it's checked and it's lower than 200 units a day. You don't want to give that up into hypoglycemia. And you want to monitor his blood pressure and respirations especially, as well as the other vitals.
And what about the psychological parameters? What do you look for that?
You want to assess his level of consciousness, make sure he's alert and oriented, and check his skin color. It depends, if he's pale or flushed.
Okay. Now, what interventions must be taught to him to ensure the medication is administered safely in the hospital?
Well, I do want him to know that the nurse needs to know the type and dose, so he would ask them what type, what dose, and let them know where his last injection was so they don't give it in the same spot. And then you want to assess for symptoms of hypoglycemia, so tingling in his extremities, tachycardia, he's pale, or assess for sometimes hyperglycemia, which is the flushed, fruit breath odor, and polyuria.
And what about when he's taking medicine at home? What interventions then?
He wants to always check his body weight and make sure that he administers the medicine 15 to 30 minutes before his meal after he's done his AccuCheck.
And what are the side effects and potential adverse reactions?
Hypoglycemia, swelling, anaphylaxis is the big one.
Gotcha. And how will you know the medication is effective?
If his blood glucose level is controlled without any effects of hypo or hyperglycemia. Any more questions before we go and administer the med?
No, thank you so much for answering my questions.
Not a problem at all. It's important to know your patient and the medication you're administering to keep your patient safe.